Welcome to OEB's highlights for the 2020-21 plan year. This is just a quick overview to give you a sense of what to expect, so please be sure to watch the carrier presentations for more details. As we've come to expect from 2020, things look a little different this year. But really, not much is changing with the OEB benefit options. One thing that looks different is we did not print paper booklets this year, so your open enrollment packet is much smaller. This helped us save money on printing and postage. All the same information is still available, it's just online now. You can find links to the booklet on quite a few pages of the OEB website, but the home page is always a great place to start. Everything you need for open enrollment is easy to find on the home page at oebinfo.com. So the first question everyone asks every year is, do I need to log in? Well, this year the answer is maybe, maybe not. You'll find a map to help you figure out whether you need to log in on page 2 of the cover letter in your open enrollment packet. We also put a prettier version of the same map on page 2 of the online booklet. They both walk you through the same questions. First, does your employer require you to enroll? Next, are any of your current plans discontinued for 2020-21? Do you want to make any changes for 2020-21? For example, you might want to add, drop, or change a plan, add or drop a dependent, or update information like your address, phone, email, text message authorization, tobacco usage, Medicare eligibility, or beneficiaries. But if you go through the questions and answer no to all of them, then no, you don't need to log in. Congratulations, and you're welcome. If you do need to log in, just go to oebenroll.com. You can actually go there anytime throughout the year to review your current benefits or update personal information or beneficiaries. You don't need to wait for open enrollment to do those things. But if you want to make plan changes for the upcoming plan year, then you do need to log in during open enrollment, which starts August 15th and ends September 15th for most members. Some employers do shut down open enrollment early to meet their payroll deadlines, so be sure to verify your deadline with your employer. If you do want to make changes, it's best to make them early so you don't accidentally miss your chance. Moving on to the plan offerings, as I said earlier, there isn't a lot changing. All the medical plan names, deductibles, and out-of-pocket maximums are staying the same. MODA's coordinated care option is still available on all their medical plans. You receive an enhanced benefit if you choose and use a PCP 360. If you already chose a PCP 360 last year, you do not need to choose one again. Your previous selection will stay in place, but you are welcome to update your election at any time by contacting MODA directly. Some new enhancements to the medical plans are Kaiser Plan 3 offers expanded preventive care services before meeting your deductible, and all MODA plans are being enhanced with a new MODA 360 healthcare coordination service, as well as some updates to the eviCore pre-authorization process. Be sure to watch the carrier's presentations for more details on those enhancements. Probably the biggest change for OEB this year is the new state law requiring a surcharge on OEB and PEB double coverage. It only affects a small portion of our members, but it is something new for those affected. Starting October 1st, 2020, if you're a full-time active employee and you cover a dependent who is also enrolled in their own OEB or PEB medical plan through their own full-time active employment, you'll be subject to a $5 a month surcharge. Note, it only applies to medical coverage, not dental or vision, and it only applies to the Oregon State Insurance Plans, OEB and PEB, not private employers and not public employers in other states. It's a flat $5 a month, even if you double cover more than one dependent. It also only applies to full-time active employees, no part-time employees, no early retirees, no self-pays or COBRA members. It mainly affects spouses or domestic partners who are both employed by the state of Oregon and choose double coverage. You don't get surcharged for double covering your children unless the child happens to also be employed full-time and eligible for OEB or PEB coverage through their own employment. So to determine if the surcharge will apply to you, first, are you a full-time active employee covering a family member on your OEB medical plan who is also eligible for their own medical insurance as an employee through OEB or PEB? If yes, then is that family member also a full-time active employee and enrolled in their own OEB or PEB medical insurance offered by their employer? If yes, then a $5 surcharge will be applied starting October 1st, 2020. If you answered no to either of those questions, then the surcharge does not apply to you. As more questions come in, we're gathering them into a frequently asked questions, or FAQ document, which will be available as a handout on the OEB website at oebondemand.com. Moving on to the dental and vision plans, it's important to note that Delta Dental's incentive plans 1 and 5 will not reduce anyone's incentive level for the upcoming plan year. Due to the stay-at-home order, a lot of people had to postpone their preventive dental visits. So if you did get to the dentist this year, your incentive level will still increase as expected, but if you didn't, you won't be penalized. Your incentive level will just remain the same for the upcoming year. There's also a new hypertension identification program built into all the Delta Dental and Moda Health dental plans this year. Be sure to watch the Moda Dental presentation to learn more about that. Aside from those two things, all the dental and vision plans will remain the same for the upcoming year. And finally, the monthly cost for employee-paid short-term disability plans will decrease by 50% starting October 1st, 2020. Rates don't often go down, especially by half. You can view these rates or rates for any of the plans online at oebplandocs.com. Don't forget these easy URLs to find the information you need online anytime. This year's digital enrollment booklet can be found at either of these first two pages, with this year's presentation videos, slides, and handouts at oebondemand.com, or with the rates and side-by-side plan comparisons at oebplandocs.com. Then, if you decide to log in and make updates for the new year, just go to oebenroll.com. And no matter what you need, you can always start at the home page for the OEB website, oebinfo.com. If you need help, OEB member services will be available from 7 a.m. to 6 p.m. Monday through Friday during open enrollment. You can call us at 888-4MY-OEB or email us at oeb.benefits@state.or.us. If staff can't help you immediately, you can expect a response within 1 or 2 business days. We hope our simplified process makes open enrollment a little easier this year. If there's anything else we can do for you, please let us know. Stay well, and thanks for watching.